Hello, I'm Darin Zimmerman from Rebalance Health and Wellness. In this video, I'm going to walk you through how to safely give yourself a subcutaneous injection step by step. This type of injection goes just under the skin, not into the muscle layer, and with a little practice, most people find this very manageable to do by themselves at home. So let's get started. First thing we're going to do is gather supplies. You're going to need your medication, a syringe, which I've uncapped, and you're also going to need an alcohol swab, potentially a Band-Aid if you're prone to bleeding, although most people do not need one, and a sharps container. If you don't have a sharps container, you can go ahead and make one out of a used laundry detergent bottle or an empty juice bottle with a screw-on cap. You also want to make sure to start out by washing your hands. I'm going to use some hand sanitizer because I'm not near a sink right now. So the first thing we're going to do is uncap our vial of medication. We're going to alcohol swab the top of it for sanitation purposes. The next thing you're going to do after your syringe is uncapped is you're going to draw an amount of air into the syringe that's equal to the dose of medication that you're going to be using. You're then going to inject that air into your vial of medication. And then you're going to pull back on the syringe to withdraw the amount of medication that you're supposed to inject. Now, subcutaneous injections goes into areas on the body that have a little bit of fat underneath. The lower belly, at least 2 inches away from your belly button, is the most common site. You can also do the front of your thighs, or if someone else is injecting for you, the outer part of your upper arm. You always want to make sure that you're rotating sites frequently. So let's prepare the site. First thing we're going to do, I'm going to demonstrate on the side of my belly here, is we'll pinch a little bit and wipe it down with alcohol. Once that area dries, we take our syringe and we go in between a 45 and 90-degree angle. We inject all of the medication and then we pull the syringe out gently. We then hold pressure, sometimes with the alcohol swab if you would like, and it sanitizes the area again, sometimes with a cotton ball, or put a Band-Aid on it. Then we dispose of our sharp in the sharps container. If you don't have one, again, use an old laundry detergent bottle or an old juice bottle or something that is hard plastic with a screw-on lid. Just make sure you label it clearly. You can take these to the pharmacy or potentially inquire about a hazardous waste drop-off site, or sometimes police departments or other local resources will have suggestions for how to dispose of these things. If you have any questions or concerns, or if you're not sure if you're doing this correctly, please don't hesitate to reach out to us. We are here to support you every step of the way.